What is that cat doing? Oh shoot.
What you need to know is your physical health dictates your mental health. So let's look at these 4 different principles of blood pressure, labs, current health history, and your family history as some of the best physical parts of your health, your physical health assessment, how this can actually help improve your mental health due to potentially being able to catch underlying conditions. Let's jump right on into the video right now. First, your blood pressure, which in my opinion is one of the most important factors to look at. So remember, we're reviewing 4 factors in regards to how you can positively impact your mental health through monitoring your physical health. Blood pressure is number 1. Blood pressure, and this is very easy, and these are even tips you can use that some of these you can just go out on your own and go do, like at some of the CVS, local CVS's, pharmacy stores, grocery stores. I know with what happened in the past, they got rid of the blood pressure cuffs and whatnot where you could check it there, but they're starting to implement that back in to where if you want to check your blood pressure, you can locally. Now, the other option, I know money can be a strain for some, is of course buying a blood pressure machine. Very easy, put it around your arm, press the button and go. The only thing you really have to understand is the direction on how to put the cuff on, but it's very self-explanatory with that. Very self-explanatory. And let me put to you why blood pressure is one of the most important things in my opinion. This is due to if you constantly have high blood pressure, there is a high chance that nervousness, constant chronic anxiety, things like there could be a higher chance of you having some of these things. So this is why you should always have your blood pressure in check. And there are a lot of conditions that can go, and then this is from a mental perspective, there are a lot of mental conditions, that do have a precursor of even things such as high blood pressure. A lot of times people, if they're not on medication for things such as even anxiety, schizophrenia, bipolar, higher chance they're going to have higher blood pressure. So that's number 1. Number 2, let's look at the labs. Now, the labs in my opinion are critically important for your physical and mental health, but this one correlates with both physical and mental completely in this regard, where they're equal in weight in my opinion, because with everything, getting your labs checked, and what I mean by this is, what do you mean? If you go and you go, I want my labs drawn, if you don't tell them anything, it'll be your basic metabolic panel, your CBC, things like this. But from that, getting your labs as well, you can right there, for example, look at things such as even thyroid disorders, blood disorders, autoimmune disorders, things of that nature that can, and once again, this is why you're going, because if you catch these things, this can play a long-term role in regards to your mental health, because depending on where you catch a chronic disorder as well, not catch, wrong word right there. If you're diagnosed with a disorder like an autoimmune disorder, knowing the diagnosis earlier you'd rather have, because you can get treatment faster and your outcomes and mental health increase. Now, sometimes people will go, well, I'd rather not know. And there are some situations where that can arise, but I'm saying you go and get your labs drawn, you don't know why you've constantly been this, that, or the other, feeling some type of way. And from there, being able to rule out a lot of physical conditions and whatnot. So that's number 2. Now, number 3, this is going to be your current health history. Now, your current health history. So why are you going to the doctor in the first place? If you're going there, I'm assuming it's for your physical checkup, your yearly exam, or another reason is you're going in there because physically you're not feeling good, physically feeling foggy, which mental fogginess and physical fogginess can go hand in hand. It can go with your blood sugars, which blood sugar as well, I will just say, with labs is very important, which I'll hit on in a little bit. Your current health history, back to that, your current health history is another way, once again, through labs, through looking at your family history, and even how you're currently feeling in the moment. For example, how much, like right now, 0 to 10 on a pain assessment scale. 10 being the most pain, 0 being no pain, for example. Where do you fall within that? Ranking it. Current health history, how you're currently feeling. Now, number 4, this is going to be family history, which I know I just said, but family history, because when you go in there, it is a good idea, if you can, ask family and whatnot about your family history. For example, let's say breast cancer runs in your family. There's a higher chance of potentially developing this. So knowing this would make it to where you'd hopefully go in and get your mammogram done, sometimes not even just once a year, multiple times a year, and depending on the situation, with that, for example, going in and getting more mammograms done, for example, you'd rather be on the safe side because you could catch it earlier. So once again, your family history. Family history can also help rule out, for example, not even rule out, but if you're going into, for example, you want a genetic testing for specific specific disorders. That's another reason you want to know your family history. Things like this all 4 of these things, which blood pressure, labs, and which I'll hit on, I'm going to go with it because I forgot to say this, but blood sugar, your current health history and your family, your past, your family history, and really your family history's health conditions, those things, that as well, not things, I keep saying that, my bad. These potential factors, these factors can really dictate your mental health. Once again, high blood pressure, a lot of times, high anxiety. A lot of times and this is where we go into it, you're feeling foggy, you're feeling anxious, irritable, and not even just that, you just feel off. What if for your family history, the family history of, for example, type 1 diabetes? Sometimes people aren't diagnosed with that till, once again, teens and even later years with type 1. Type 2 is a little bit different, obviously, but insulin resistance versus just not even producing insulin at all, which is type 1. These kind of things, and diabetes in particular, if diabetes is not being treated, or a chronic condition is not being treated, but let's go with, for example, right now, let's go with your blood sugars. If they're not being treated and they're chronically high, that's going to cause physically for your body to break down faster, which can cause, nerve conditions, nerve disorders, neurological disorders, you name it. Anything like this can cause a numerous number of things with high or low blood sugar, which from there really can dictate your mental health. So in my opinion, how I look at it, if you're going, well, what should I go do first? Should I go go get a physical exam, or should I go see my mental health, or go see a mental health clinician? Honestly, they're both equally important, in the fact that you're wanting to get this and you're wanting to go get this taken care of is really what matters. But in reality, I would first start with your healthcare provider, your general practitioner, or your family provider, because this is where your labs, like even thyroid disorders. For example, in my family, hypothyroidism runs in our family. So for me, going in and making sure I get this checked, minimum once a year, especially as you get older into your 30s, in particular, and 40s, ruling things like this out early will really help long term. in my opinion, with things such as potential mental health problems down the road. So I think physical health, I think you would start on the physical side for labs and whatnot, and then from there, if nothing can be ruled out right away, if like there's nothing instantly ruled out, for example, let's say your blood pressure is high, things like this. And I'm not saying just get put on a medication. That's not what I'm saying for it. I'm just saying doing this to where you can try to improve, for example, your blood pressure, things of that nature, which can really help with your mental health. So my whole point to this is make sure you're keeping an eye on your physical health as well, and recognizing just in general how you're feeling, blood sugars, going to your doctor. Are you following up with your doctor if you're saying, hey, get this, make sure you're monitoring your blood pressure, you name it. These things together, once again, help build and maintain our temple. Yes, people from out, everyone besides myself can view me from a physical perspective, like you can see me, but you'll never know, for example, completely how I feel, and that goes for you as well. Nobody knows completely how you feel. You're the one who knows this. And this is why always keeping some of these basic principles are very important in the long term with your physical and mental health. Don't put either of these off. Very important not to. These two elements of your life, which once again maintain your temple, will lead, if you're really maintaining and watching both your physical and mental health, I believe long term will lead to a healthy, a more just plentiful, fruitful life, where down the line, for example, when I have kids, I'd like to be able to, for example, and this isn't even from a mental health perspective, be able to bend over and be able to actually hold my kids, or be able to squat, be able to still squat. Things like this are super important that you got to start looking at now. My rant on that is over. This is your daily dose of mental health. I hope this helped anyone out there who, outside of your mental health, you can really follow up and look at your physical health as well. I hope that helps someone out there. Leave a comment in general if your physical health and your mental health, if you even notice some of these correlations, or if your physical health dictates you feel like your mental health, or vice versa. Like and subscribe, leave a comment. I also have my Patreon where I'm going to be starting to post extra stuff as well coming up. So check that out, join that. There's two different types of memberships where you can join for free as well. I love you all.